Statistics show the busiest birth months in the U.S. are July through October, which means we are moving into the time of year when the majority of babies are conceived. Swedish says it delivers more babies than any other healthcare system in the Puget Sound region, and I'm actually one of those babies. Dr. Tanya Sorensen, Executive Medical Director of Providence Swedish Women's and Children's Institute, joins me now. Thank you so much for being here.
Well, thank you for having me, and I'm so excited that you were born at Swedish.
Yes, I have the iconic photo with the blanket and everything. I don't know if you all still do that, but
we still do.
Okay,
Yeah.
perfect.
Yes.
And I didn't find my picture, but I should have brought that. So Swedish cares for patients, like we were saying, through uneventful pregnancies to preemies, and you just opened your small baby unit. Tell me about that.
That's right. The small baby unit was opened about a year ago, and it serves babies that are born between 22 and 29 weeks. And those are the littlest babies with the highest risk of complications, and they have vulnerable brains, they can have bleeding in their brain, their lungs may not develop properly, lots of challenges.
Wow.
The small baby unit is a unit that's really using the absolute cutting edge best practices. So everything from the right ventilator to the right kind of medications, but equally importantly, it's the environment that these babies are in. So it's a dim light environment, low noise. The protocols call for, minimizing noxious stimuli like blood draws and those kinds of things, and maximizing, time with the parents and the touch time with the parents.
Absolutely.
And it's actually improved our morbidity and mortality in those kids by 50% over the year. So it's pretty incredible. I'm super proud of that team.
Oh my gosh, absolutely. That is incredible. And we want to talk too about all the other, programs and stuff that you have going on and the services for OB, pregnancy, and childbirth. What else is happening?
So we really do deliver care for low risk women and the highest risk women. And our low risk pregnancies, what we try to do is offer really high touch, low tech approach for really a good experience. And a great example of that is our midwifery program, where they do all kinds of things from centering pregnancy during the prenatal period to really being there for the patient one-on-one during the labor and delivery. And that they have great outcomes, and the patients really have good experiences. And then on the other end of it, we take care of patients who are the highest risk patients. They might have diabetes or high blood pressure or a placenta problem or a growth problem with the baby or genetic problems with the baby or substance abuse. And so those pregnancies require a lot more high-tech care, but we can really take care of any pregnant patient with those kinds of issues.
I love it. I've had many friends that have delivered and had a wonderful experience. And midwives, doulas, what's the difference there?
Yeah, so doulas, and I would love to talk about our doula program as well. Doulas are people who are trained to support the patient in childbirth. Midwives are actually doctors of nursing practice, so they have a lot of experience and are very, they are highly trained to do that work. Doulas also get training, but they're really meant to be there as a support for the patient right there at the bedside.
I love that. That's amazing. And you wanted to talk about the program for...
We do. We have a wonderful doula program that helps to supply doulas for patients who want them, and we really encourage patients to have doulas because doulas really improve outcomes and experience. In addition, we have a birth equity program called the Just Birth Network, and we're matching patients of color with doulas of color and really trying to provide some culturally congruent care, because there's real inequities in outcomes among Black, Native, and other patients of color compared to white patients, and we're really working hard to reduce those disparities. The doulas are a great way to help with that. We have cultural navigators, and we've just instituted a program called Team Birth, where we really are at the bedside with the whole team, including the physician, midwives, resident, family, doula, everybody, at key points during the labor and delivery, where we can talk about what's going on with the baby, what's going on with the mom, what's going on with the labor progress, and make decisions together as to how to proceed, which is just a way to really, again, improve outcomes, but also really improve the patient experience and put that patient at the center.
You are just doing incredible work. Swedish is incredible. And where should people who are expecting or planning to become pregnant start their medical journey?
Well, I would recommend going to swedish.org.
Okay.
And there are clinics throughout the region, and they should choose a clinic that's close to them, that they want to talk to you. And if they just call in, we can guide you into what kind of care you want and what options you have. And we're happy to do that.
Wow. It was absolutely amazing to talk to you. You all are doing amazing work. So thank you so much for being here.
Thanks for having me.
Yes. And to find out, of course, more about giving birth at Swedish, go to swedish.org/pregnancy right there on your screen.
This portion of New Day Northwest is sponsored by Providence Swedish.